thank you, Katie. And I think over the next hour, our goal is to have our listeners and viewers be more informed about several resources that are available to them in our area. We're going to learn about members of an Americorps program that work for Somerset Public Health and folks who have been trained as community health workers. But before we do that, and before we get into specific introductions, just some background on our area that, you know, I think most folks are fairly aware of, but sometimes the statistics help bear out the landscape that we're dealing with here in Somerset County. As most folks are very aware, Maine is the oldest state in the nation, not historically, but by the demographic of the people that live in Maine. We have issues such as obesity, diabetes, and heart disease, and a topic that we'll talk about a little bit later called food insecurities, and we'll explain what that term means. But some statistics that are just out from the J.T. Gorman Foundation, which polls a lot of this health information, finds that in our county, in Somerset County, 39% of the population is categorized as overweight, and 33% of the population is categorized as obese. Personally, I take issue with these numbers because I'm one of them. But I just think our problem is we're not tall enough. If we were all well over 7 feet tall, then those charts would go away. That would be my concern. But I think that no matter how you try to spin it or maybe put a positive spin on it, it is an issue. The amount of folks in our area that are overweight, I think, is directly tied to this other statistic that so many of us have a sedimentary, or maybe it's a sedentary lifestyle. Sedimentary is a rock, right? Yes. Which well, I guess if you're sedentary for long enough, you become that. But basically, this is a lifestyle where you don't have a lot of activity. Perhaps you don't get out of the house very often. Or even someone that goes to work may sit at home, sit in the car to work, sit at work, and sit when they come back. So they don't get a lot of activity. And that makes up almost 30%, almost a third of the population of our county.
And added to, Tim, to that statistic would be senior citizens who are isolated for various reasons in their homes, especially during the winter months.
Right. Smoking continues to be an issue where 26% of the population of our county smokes on at least a regular basis. That's 1 in 4. 18% of our population is over the age of 65. And in this, what I found to be one of the most striking parts of these statistics is depression. That 1 in 4 of the residents of our county, 26% deal with depression in one form or another. Mm-hmm. So all of these statistics point to the fact that I think it would be safe to say that our healthcare system has a lot on its plate, and it may be overwhelmed in certain areas. So one of the solutions that was proposed in our area was, can we find folks that would be willing to volunteer to provide a connection for folks, to connect folks to services in the area that might help address some of these statistics and many other situations. So my understanding is that through Somerset Public Health, a grant was written for Americorps volunteers to come and fill a number of positions. And I believe that you ladies have filled 3 of those positions in the area. Mm-hmm. So we're going to do a more formal introduction in just a moment, but before we do that, I'm going to ask Liza Russell to tell us a little bit more about Americorps to kind of lay the foundation for us.
And I do talk with my hands, so just know that going into this. So Americorps is a national service program, and I think it might be easy to think of it as a domestic Peace Corps. Mm-hmm. In this particular program, the main commission for community service is funding this program, and medical care development is managing the program through its public health sector. So we're still looking, or I should say that Medical Care Development is still looking for members, and you can go to their website, which is simply mcdph.org, all lowercase, of course. And then you go to their employment page. So you can get information, check into it, see if it's something that you want to inquire more about. We've been doing this for 4 months now, is that right?
Since September.
Yes. And we're still learning. So the focus for this Americorps program is, as you were saying, Tim, addressing these health barriers, supporting the senior population to age in place. We are very rural. I think we're the 3rd most rural county in the state. And that contributes to the isolation piece. So there's the general umbrella. We do have several organizations participating in this program. Hospice Volunteers of Somerset County, Sebasticook Valley Health, Health Reach, Kennebec Health, Behavioral Health, as well as Somerset Public Health.
And the Somerset Public Health Office is the primary office that you three work out of?
That's correct.
And I'd like to interject exactly where that's located.
Mm.
On the Rotary in Skowhegan, it used to be the old Federal Trust building, just before you get to the turn by Heights, but a lot of people don't know that we're there, and there's a sign and everything is there, but they're not sure of who we are and what we do. And so that's part of what we'd like to address today as well.
There's a lot of ways to reference Somerset Public Health. One of them is Bill Primmerman's group.
Right.
Because Bill has been associated with them for so long and a kind of a fixture in the greater Skowhegan area. And has done a wonderful job of managing that team and that group. It goes back to, you'll hear people say, oh yes, Somerset Heart and Health, because that was one of their original titles. And then they came up with the Greater Somerset Public Health Collaborative, which really rolled off the tongue. And so they shortened it down to Somerset Public Health just a couple of years ago. But you're right, it is good to let folks know where that is, because they are a great resource. When you walk into the office, the first room there is full of all sorts of literature and resources that deals with everything from activity and exercise to public health and all that. And I know that he has a great staff, and he's happy to have you folks there as well. Let me ask just a little bit about Americorps, in case there might be somebody in the viewing audience that would be interested in serving this way. Americorps members volunteer their time, but there is a living wage stipend paid for their time.
That is correct.
How do you find this volunteering work compares to a regular 9-to-5 job?
Well, for me, I look at it as an apprenticeship program. There is a lot of training. There are some added features. Some of us can earn what are called education awards. Either of you want to add a piece here?
Yep. The education awards apply to if you want to go further in your education, go to college. It's something that the government provides as a nice bonus to being an Americorps member. Full-time and part-time, I'm not sure if quarter-time.
Right.
But full-time and part-time do get the education award. And in comparison to for a full-time job, we work anywhere from 36 to 40 hours a week volunteering our time, but there is a living stipend that for full-time members that we get.
And that education award, if you do not use it personally, can be passed on to your child or to your grandchild.
Right.
Yeah, and that only applies if you are 55 years or older. Anyone under 55 can only use it for themselves.
And There are different segments to Americorps as well, and that can all be addressed if you go to that website for medical care development and make an inquiry about the program, where the needs currently are to fill more of the member roles here, or if there are some other programs that might pique someone's interest to be a member for.
I checked out the mcdph.org website the other day, and just going to the employment link on that page, and it was really easy and simple to understand and to continue on in that process. So yeah, check it out.
There are other opportunities that wouldn't be just doing exactly what we're doing necessarily.
No, yeah.
There are many different opportunities.
And each of the organizations that are participating in this particular Americorps program, their needs for potential Americorps members would be a little different than what our functions are under Somerset Public Health.
Yeah.
It seems like the purpose of Americorps is trying to draw folks from a wide variety of life experience and life skills. The education credits certainly appeal to younger folks.
Absolutely.
But I like that additional benefit they've given to folks that are perhaps over 55, that they may not use it, but they might be able to grant it or gift it to one of their children or grandchildren. That's also an incentive. And I think, as you mentioned, it's a nationwide program, and so one of the things that I was always a little bit confused about is an agency like Somerset Public Health will apply for an Americorps grant, and they'll be granted 5 or 10 positions. And some folks thought those positions are already filled, so you'll be getting 5 or 10 workers automatically. But just because those positions are granted, then from the local area, people are recruited or sought out to come and fill those positions. So just because a agency gets an Americorps grant doesn't mean they automatically get a person.
That's correct.
So people need to be aware that if that's something they want to do, they can find out more information from those websites that you had mentioned.
And one of the stipulations is you live in Somerset County.
Hmm.
This rules. Is
For
that
this,
correct?
for this program, that's correct.
Yeah. Well, great. Well, thanks for kind of laying that foundation for Americorps, but now let's find out who you people actually are. We'll start with Cheryl Curtis, all the way over on the left-hand side there.
Yes. I'm really excited to be a part of this program. This past September, I was able to see my last child off to college, so I had a whole new opportunity in front of me, and I could, and this was perfect timing. It just kind of fell in my lap, and so it enabled me to go from primarily being a stay-at-home mother, taking care of all my children, to now giving my time to our community. And it's been wonderful. My heart's been for our elderly. Our focus as Americorps community health workers is for the elderly, or anyone 55 and older. And we will help anyone who does need help as well. But I had the opportunity of taking care of my mother over her 10-year period of having lung cancer and flying back home to Canada 3 different times during that 10-year period. And I stayed with her for about 3 months in the latter part, and just took her all the way from home to hospice, and then finally was able to say goodbye. So my heart is there for the elderly, and the resources that they need to be able to stay home for as long as they possibly can, enjoying the life that they always had. So that's why I'm doing the job I'm doing.
Great.
So, yeah.
Thank you. Christine Benchak.
I keep retiring and going back to work. I started, of course, my career in Madison as a 6th grade teacher. I was over there for over 30 years. And I retired early to take care of my father after my mother had passed, and we had hospice help with her at the end of her life. And when it came time for my dad to have hospice, it was just incredible. And after he passed away, it was like I needed to invent myself again, because I didn't know what I wanted to do. And I started attending a bereavement group in Skowhegan at Somerset,
Hospice
Hospice volunteers in Somerset County, thank you. And just happened to say one day that I thought I would like to find a part-time job, and the job opened up, and I eventually became the bereavement counselor at Hospice Volunteers for 4 years. I retired again a year ago, and decided I didn't really like staying home all that much, and Liza called and said, Christine, there is this wonderful program that I'm involved with, and Cheryl Curtis is a member also, are you interested? Yes, I'm interested, because I want to connect people with programs that, whatever barriers are preventing them from receiving what they can receive, and I'm still wanting to give back to my community for everything that I have received.
Liza Russell.
Well, I've been a practicing licensed dental hygienist for 40 years, and it was time to go beyond that. So much of dental hygiene is about prevention. It's about making choices that don't get us into trouble. And it was time, like I said, to move on. I'd already become a bereavement facilitator through Hospice Volunteers of Somerset County because of the loss of my first husband. I do a lot in my own life that has to do with healthy choices, exercise, organic gardening. So I know the personal benefit of those preventive choices. And this program came along at precisely the moment that I was saying goodbye. I'll tear up a little bit. Saying goodbye to my mother. And I had made a conscious choice. She lives elsewhere in the state of Maine. And I realized the time that it takes me to travel, I could be better putting into my community here. And trusting that others, where my mother was living the last of her days, would find others in her community to support her, as well as my siblings. So I saw this job description, and it was just perfect. And I went, submit. Because it is what I would be doing for my mother if we had lived in the same community. And also my penchant for serving. I am an ordained interfaith chaplain now too, and simply being there, being present for other people in whatever circumstances they find themselves in. So all of those pieces brought me to push that button, submit.
I think it's fascinating and really encouraging to hear all three stories and the common thread that runs between them of caring for not only senior citizens, but caring for your own loved ones.
Mm-hmm.
I think that experience helped shape you to be the people that you are and to be the fit for this job that you found. And I just like to say, I think all your folks are very proud of you for what you're doing. So let's spend a few minutes now talking specifically about what it is that you folks are doing in the area. You've all been trained as community health workers. So one of you kind of give me a little bit more about what that means.
Well, it was a week-long training in Augusta from two wonderfully informed women from the DC area, and it was everything you could possibly, every scenario you could possibly think about. And the one thing that came through for me was, and over again it still does, is accept people where they're at. If there's a program that you think would benefit this person, don't want it more than that person does. And that's a good rule of thumb to keep in mind.
Yes, we walk alongside people. And there is a certain component of supporting them, of reflecting back to them, of letting them bounce their own thinking off of us. But always, it's about empowering that person. And they do have their best thinking and their best decisions. We don't have that for them, they do.
But these opportunities and the walking alongside people and coming to help them make their own choices about their own health, it has to take place physically somewhere. So you're located in a couple of different places as I understand it. But
Yes.
some of your time is spent in some of the medical offices over at Reddington Fairview, is that correct?
Yes.
Correct. We are both upstairs at Skowhegan Family Medicine and downstairs at Reddington.
Medical primary care.
Thank you. We know the acronyms. And one of the other benefits to our program is if there's a transportation issue where you can't come to us or whatnot, we can do home visits. Or we can meet at the town office, anywhere, really, we'll be willing to travel.
But let me ask you about in the medical office buildings. Say one of the doctors has a patient, and as they're going through their patient care, they realize that this person might need some extra help or might need to be connected with some resources. Maybe it's about food, maybe it's about getting connected with some of the mounds of paperwork that needs to be gone through to get people connected to resources. Is there a way that the doctor or someone on that staff in the doctor's office gets that patient to one of you? How does that work?
Those are some of the nuts and bolts of the program that we've had to, as it's sort of a mantra, we've been building the road as we walk it.
Yes.
So we've had to, with our project manager, create those documents, create those step-by-step protocols of how that is supposed to happen. We're still ironing out
We
some
are.
of the details.
It's generally a referral from either the nurse or the doctor that we receive back on paper. Or if they're there at the medical office building, we'll go in and do a warm handoff. They'll introduce us and we'll be right there with the patient and able to explain what we offer and go from there.
And this, I understand, would be a little bit of a process. Either you meet the person face-to-face or on the phone. I'm sure you have to get them to sign off on permission to speak
Yes.
with you and that sort of
All
thing.
hospital protocol.
But once you've followed all that protocol, then you have the opportunity, I'm assuming, to meet with them in their home or meet with them at the doctor's office and kind of help them through some of the struggles that they're going through.
Yeah.
And the doctor may be aware of one struggle, but as we're talking and developing with the client or patient, other issues arise that we may be able to help
Right.
with.
And I would imagine some of the examples, and let me just pull from some common themes in our environment here. People may have had coverage through main care, but now they've lost their coverage for whatever reason. People may have had income or health benefits through the Veterans Administration, but they've lost those. And so they've stopped going to the doctor, they've stopped receiving services because they don't know, all they know is they can't pay for it anymore. So this is a resource where you would come alongside someone and maybe even actually help them fill out the forms, make the phone calls with them.
Yes.
Because if you've ever tried to call one of these agencies, it's difficult. And I'm assuming that might be one of the things you talk about as barriers
Yes,
Right.
absolutely.
that you might be able to help someone through.
Yeah.
Because, if I'm in that position, I'm just gonna give up. And that's where the resource part of this really comes through.
Yes, it can be very intimidating and fearful to have to go through it alone, and knowing that there's someone like us beside you, walking through it, another set of ears, hearing what the person on the other line is saying and asking for. It gives a sense of security and surety to the whole process. So we are empowering them by taking charge with what they want to do, but just being that extra help.
One of the first questions on the referral that we ask the patient is how can we help you?
Mhm.
What is it that you need help with?
Yeah.
Because the direction needs to come from them. What's most important to that person?
That's right.
I think you made a good point. The doctor in his or her 20 minutes may only be identifying one that might
Mhm.
be related to a number of other issues, or maybe just be the tip of the iceberg. And it would be a shame, and I'm sure it happens all the time, that patient goes home and there's nothing done. So this is a...
We're a connection between the doctor and the
Right.
patient. And quite often, how many times have we heard people say, well, you didn't tell the doctor this, and you didn't tell the doctor that. I told the doctor I was fine.
I knew a man once that tried to go to the doctor without his wife, and every time he came home, he had a list of questions that he had to answer from his wife, so he just gave in, and his wife now goes to the doctor's appointments with him.
That's good.
So, I just want to make a clarification here. As a community health worker, you're not a caseworker, so you're not spending months or years with a person.
That's correct.
Your goal is really to connect them to the resources and empower them to continue to make
Mhm.
good choices.
Mhm.
Yes.
That's a good summary.
So working in the doctor's office is really just one aspect of the work that you're doing. Another is, and again, I think we joked about it off camera, public health speak. So another job is facilitating evidence-based programs. So to help me with that, what is an evidence-based program?
Well, simply put, it's a program that it's had evaluation research that shows this is working.
Okay.
This has had a positive impact in the lives of the participants. And we have several of these programs, some of which we've been trained to facilitate, and some of them in that other category. Here's the phone number, here's the person, here's the contact, and we encourage someone to look into that program. One program that I'm familiar with is Bone Builders, that is sponsored by Maine General's RSVP, which means Retired and Senior Volunteer Program. And that program is for anyone who has concerns about balance, the risk of falling, osteopenia, osteoporosis. It's an exercise program that evidence-based means it's been shown to improve all of those risk factors. And the number for anyone who is interested in getting some more information, perhaps enrolling in that particular program, again, it's Maine General RSVP. The number is, where did I put it? Right here, 861-3534.
Now, I believe that there's a Bone Builders class that utilizes the space at the Old Point School in Madison at 108 Old Point Avenue.
Right here, yes, and about a year or so ago, I attended that class to find out more of what it was like. It's a happy group of people. They get to know one another. They have a commitment to themselves, to their health, and I think it's fair to say they bond with one another.
And
So it's ongoing.
Liza has taken the training, and she's going to be recertified.
Right.
What I like about the program is you go at your own speed. If you aren't steady on your feet, then you do the exercises sitting down.
Right.
It's amazing.
There are ways to adjust the exercises because you begin the program where you are. There's also a program in Emden, there's one in Pittsfield, and there's one in Cambridge. So if you're in any of those locations, or if anyone's interested in taking the training to become a facilitator, these programs are out there.
So Bone Builders is a good example of an evidence-based program. The evidence shows that this type of exercise works, and it deals directly with some of those statistics we talked about.
Yes.
If people have issues with balance and stability, they're less likely to get out and less likely to have that active life that leads to better health. So it's, you're taking a look at the evidence on both sides. Where's the need and what do we know that
Right.
works?
We also know that falls are the number one reason seniors end up in the emergency room, so.
Right. So that's one example. Another example of these evidence-based programs is called Living Well for Better Health. So tell us a little bit about that.
Well, it's a wonderful workshop. Liza and I finished our Living Well for Better Health workshop back in December. And it's a 6-week workshop held once a week for 2.5 hours each session. And some of the discussion and activities that we cover in the topics are dealing with frustration, fatigue, and isolation, exercising at your level of ability, working effectively with your healthcare provider, setting personal goals, managing your pain, healthy eating, improving communication skills, and making informed treatment decisions. Anyone can come and participate, a family member, someone with a chronic condition, or a caregiver, someone that's taking care of someone with a chronic condition can participate and benefit from coming. And so those that come, the participants, they will learn how to set goals that are doable, learn to work with others, problem solve, learn how to make their daily tasks easier, relax and manage their stress, find support and solutions to their health concerns, and they'll learn how to work in partnership with their healthcare team. Benefits to participating in the workshop show that there's significant improvements in exercise, ability to deal and manage their symptoms, better communicate with their doctors, receive increased support, and spend fewer days in the hospital and have fewer outpatient visits and hospitalization. Our next Living Well for Better Health workshop is February 25th in Smithfield. And if anyone's in that area or can get to Smithfield, please call Somerset Public Health at 474-7473. And if you can't get to Smithfield but would still be interested in taking the Living Well for Better Health workshop, please again call Somerset Public Health and we'll put you on a list and we will contact you when the next workshop is available. One other thing I wanted to mention was in March, the 17th, 18th, 24th, and 25th, it's a 4-day training to actually be a workshop leader. So, and that's held at the Hathaway Creative Center in Waterville. And it's free to participants who'd be interested in volunteering their time to lead these workshops. So if you have any inclination to do so, please again call Somerset Public Health at 474-7473.
And I want to just add that it's an incredibly fulfilling experience. We
Oh.
just love doing it.
We did. We didn't want the 6-week workshop to
Right.
end, and neither did our participants. They really, really benefited, and they wanted it to keep going on. And so it was just a really great group of people, and they really enjoyed what the group dynamics did for each other in there.
I attended as a student.
Yes, yes.
And it was an eye-opener. It was awesome.
So this is called Living Well for Better Health, and people can find out about it through Somerset Public Health, but also people can find out about it if their doctor refers them to something like this. This may be a resource that would benefit them. So sometimes doctors' referrals help fill this group, and also people that may have benefited from it in the past, they can spread the word to their family and friends that this might be a benefit to
Or they come
them.
back.
Or they come, so there's no rules that say once you've taken it, you can't come back again.
No, we had a participant that this was his 3rd time taking the class, and he said this 3rd go around, he said every time he learned something new, and it really, made that much more of a difference in his life.
It's just like reading a good book. The second, third time through, you realize, oh, I don't remember that from the first reading.
And I think you touched on something that I wanted to explain a little bit more about, giving folks an action plan or an action step. What does that mean?
Well, during the workshop, every session we create an action plan for the following week. And it's an action where you plan to do something that's very doable for you, and you can manage it any which way you need to. If what you initially start out to do is maybe a little overwhelming for you, you have the power to cut it in half. You manage it. It's your action. And that action plan, it builds on each other. It builds during the weeks that we have the sessions, and it really empowers the person to say, I've accomplished something. I am in
That I've
charge
been
of my life.
avoiding, or
Yes.
it's been overwhelming for me, and you break it down into
Absolutely.
small parts.
And I'm
Yeah.
reforming my life,
Yes.
reforming my day-to-day, hour-to-hour existence.
So someone might come to one of these workshops with a stress level because their house is in disarray, or perhaps they still have boxes and boxes of things left over from the moving out of a loved one or the death of a loved one, and then they don't know quite how to handle it. So they might come to the first meeting saying, well, my action plan needs to be, I have to clean my whole house.
Yeah.
But
Whoa.
you would encourage them to break it down, and let's
We
One
do.
box
Right.
at a
We
time.
let's start with one box,
Yeah.
or maybe
One
let's start with
corner.
the junk
Right.
drawer in the
Yes.
kitchen, just start there.
Yes,
And-
right.
somewhere.
Yeah.
That gives people the encouragement to say, okay, this is not as overwhelming as I thought it is.
I just picked up a new book Saturday, and I have only read the first chapter, but it's me totally, because it's when you say goodbye to something, or you look at an object that you've held on to, and you decide what emotional attachment do I have with this object, and secondly, can I take a picture of it so I don't keep the object, or so many objects, or can you let it go and say thank you for the presence that you've had in my life, but I don't need you anymore. And so it's very spiritual, so I'm anxious to continue reading that book.
So these workshops, do they go on for months and months? Is it, how long a time period are people committing to?
6 weeks.
Okay.
Just 6 weeks.
Okay.
And you can re-up at the next
Well,
one.
that sounds great, that they
Yeah.
can take another one
Yeah.
over and over again. Christine, I wanted to talk to you a little bit about another one of these evidence-based programs. And I believe this has to do with diabetes prevention.
It does. It's what is pre-diabetes is my question to answer. Pre-diabetes means that you are at risk for developing type 2 diabetes. At risk means there are several determining factors, and your doctor may recommend this National Diabetes Prevention Program. We use the acronym NDPP, and I have to stop and think what those words are sometimes because we use it so often. A self-risk quiz is available online at the Centers for Disease Control. I took the quiz, and I didn't rate as well as I thought I would. Your family history, your age, your eating habits, your weight, all of those things are factors. The National Diabetes Prevention Program is designed for people who have diabetes or who are at risk for developing type 2 diabetes. A trained lifestyle coach, which would be us, leads the program, focusing on helping you to change your eating habits, reducing your stress, and participating in healthy activities, along with sharing your goals and struggles with others in other group members. It is a year-long program. This one's a little bit longer. It's once a week for such a period of time, and then it's bi-weekly, and then it's monthly.
Okay.
It may sound like it may sound like a long commitment, but it takes a while to learn those new habits and skills, as well as building your self-confidence, and hopefully reducing your risk from developing diabetes. So if you're interested in this program, or any of our programs, again, I'll plug for Somerset County Public Health, and the number will be on the screen at the end of this program as well.
That, a program similar to that I participated myself in about a year ago, and it helped with weight loss. And one of the things that really stuck out to me in that program was it wasn't a diet program. It wasn't saying, okay, you need to watch these calories and watch this and watch sugar intake and carbs and all that. It was very simple. And one of the things that they offer, which again is evidence-based because this has been proven to work, if you track what you eat every day, you will most likely reduce your intake of unnecessary fat and calories. And so it's something simple It's like I tell my doctor nearly every time I visit, I know what to do,
Yeah.
I just don't do it.
Right.
And so,
Don't we all?
those are the tools that help.
Right.
So that's great. So, we've touched on several of the evidence-based programs that you folks help facilitate as part of your job with Somerset Public Health. And each one of them meets a different need in the community, especially amongst those in our senior population. One of the struggles that I think you probably have all seen is the struggles with transportation in our area. We get calls at the Madison Town office every once in a while because people, they know that the programs are available to help them, like bone builders, or like even utilizing the local food cupboards and that sort of thing. They know those resources are there, but they call because they can't get there.
Yeah.
They don't, and what's interesting is, some people may only have a car a few days a week because they're sharing with someone else, or one member of the family has to go to work. And so the rest of the family is without transportation. It's a big issue. Somerset County is a big county. It's a rural county. Everybody is stretched out. And it's a county that lacks the financial resources compared to some of the other counties in the lower part of the state. So I know on this program and other programs on Channel 11, they've focused on the Somerset Explorer bus program. And I know you folks have had an opportunity to learn more about that. And I just want to give you folks the opportunity to talk a little bit about transportation issues.
I think we'd like to tell you about the Somerset Explorer and the other issues, and then share our story
Yeah.
with the Somerset Explorer trip that we took. The Somerset Explorer is a bus route, Mondays, Wednesdays, and Fridays during the winter time. There's a route in Skowhegan that has planned stops at, and the pickup place, point is the Chamber of Commerce building. And they go to Walmart, to Hannaford, one stop could be the Dollar Tree, if you so desire to stop there. The cost is minimal, it's $1, or $1.25 if you take the Madison route, is my understanding.
Yeah.
KV Cap is another transportation availability for medical appointments, as well as if you don't qualify for free KV Cap, it can be paid for by individuals. Penquis is the transportation for main care, people who qualify for main care, and that's again another method of transportation. And a new one in our area is the Hospice Volunteers of Somerset County. With a couple of a day's notice, they will transport people for 45 cents a mile if they don't qualify for the free transportation. We're very interested in what takes place in Jackman. And Jackman is at the top of our county, and they're very isolated, and the issues there are the same, but they're different. And we do go to Jackman twice a month. They have developed a program in Jackman in which there's a volunteer who is the dispatcher, if you will, and people call that volunteer, and he or she makes the connection with another volunteer who help people get to their medical appointments in Jackman, get to the store, get to the drugstore, wherever they need to go. And if we start taking control of things like that and start developing those types of transportation here in our own communities, how wonderful that would be. And look what it would also solve as far as the social isolation, the doctor's appointments, all of those things. So it's just, it works well. And I'd like to say come to our areas as well.
For folks that work in the town offices in Anson and Madison, Skowhegan, these resources are great, and it's helpful for me to know, because sometimes when we get a call, we just shrug our shoulders and we don't know where to send people. We don't know how to help them get to the resources that they need. So all of these
Yeah, we're known as the three
helpful.
resource girls.
The resource
Yeah,
girls.
we're the resource-
And you could do a community referral to us and say, I happen to know some people who might have some answers.
Good,
Absolutely,
good to know.
that's what we're here for,
And
to connect those people.
I think it's great that you look at what other communities are doing, like Jackman, that's working, and you try to brainstorm and figure out, okay, how can we use that as a model for something that we can help our area, our greater community right here.
And right now, Jackman is trying to, because the volunteers use their own vehicles, right, and they're actually applying for grants in order to purchase a vehicle that can be used for that, right within the town.
But I'm gonna put in a plug, if anybody has a vehicle that works great and does not need it, it is needed in Jackman. So, please contact Somerset Public Health.
Again,
69 Beetle convertible.
No.
That's a little.
But this would be a great way for people to volunteer.
Right.
As far as,
Right.
here in Madison could develop a program such as this.
Or connect with hospice volunteers of Somerset County
Right, and-
as a volunteer for this
Right.
transportation program.
Right.
Yes.
That's great. So there's a lot of opportunities for folks to plug in. I've kind of watched this Somerset Explorer bus route develop over the last couple of years because it has that circle in the hub in Skowhegan. It goes off to Madison, has some stops here, has some stops over in Norwich Walk.
Anson, stops in Anson
And
as
over
well.
the Anson area as well. And so it really gets around, and you folks had the opportunity to spend a day on the bus. And while that doesn't sound exciting to me, I hear it was pretty
was.
exciting.
It was a blast, it really was.
It was.
Our first field trip, perhaps.
It
Yes,
was.
it was. But we want to know the ins and the outs and how things work before we mention those to our clients.
Mhm.
And one of the barriers of the Somerset Explorer that we've heard from our clients is, I've never done this, I don't know what to do, will they pick me up?
Yeah.
And so our function will be connect them to the bus, but also go on the bus with them the first time, with that confidence. You know, that's what we do, that's what we're gonna be doing.
That's a great step, because you can tell people this is when the bus goes by your house, but that, for a lot of folks, that's not enough to actually get them to take that step.
And that, while that's a physical description of how we accompany people, it really stands as, that's what we're doing. Whether we accompany people in their thinking, in processing forms, that they're not alone. That's hugely important. I know it has been for me in my life, to know that I'm not here doing this on my own.
In my mind, if I'm taking public transportation, I'm in a large, cold, sterile bus, and I'm all by myself, and I just kind of pull my shirt up and I don't interact with anybody. Is that the experience?
That's normal big city public transportation, but that is not the Somerset Explorer here. The Somerset Explorer here is like a little community unto itself. Very warm, very welcoming, anyone can ride, and they get to know you. They greet you. I know that, I think they even write out birthday cards to each other on the bus. It was just a wonderful, wonderful opportunity to meet people. And I know we don't have the number for Somerset Explorer for people to call, but if you want to ride, it's really important to call to let them know where you are, and they will be there to pick you up. That I'm going to stress that. That's very important, to call the number.
And they can connect you
You have the
to
numbers, too.
some of the common areas. Like I know in Madison, they stop behind Rennie's.
Mhm.
They stop
Yes.
at 1 Madison
Right.
Avenue. So some of the common areas where people can gather to get to and from the bus stop.
Yep.
And there is a chart online as well
Yep.
as available where the stops are. And in the summertime, the bus runs more frequently, as well as out to the Lake George area.
Yeah, it goes out to
So
Canaan.
actually, someone could board the bus in Madison, switch buses in Skowhegan, and end up in Canaan,
Yeah.
if they chose to do
If they
so.
want to spend a few hours at Lake George.
Right,
yeah.
and it is
Yeah,
handicapped accessible,
Great.
wheelchair
Yes.
accessible, for
Great.
sure. But as soon as we got on the bus and explained who we were and why we were there experiencing, we heard all their stories.
Yeah.
It was awesome.
People were very open,
Very,
very
very
sharing,
open,
very
very
interested in
warm.
us. You know, it was a lovely experience.
Mm.
And they do have pit stops
Yep.
Yeah.
along the route. And we were rather pleasantly surprised when we were on the Madison route, went to Norwich Walk and stopped at one of the local stores, and they all went in, bought lunch, and came back and had lunch on the bus. So it serves many purposes, but that social piece right there for a
Yeah.
lot of them, we met people who do it socially, they just ride the bus.
Yep.
there was we picked up some women and men who ride the bus in order to get to their employment.
Right.
And they depend on that. And then some, of course, to appointments.
Right.
Or grocery shopping or whatever.
The bank.
The bank.
And the bus does go up to Somerset Sports and Fitness
Yes, it
too,
does. That's
so
right.
exercise,
Exercise.
you know.
So there's a lot of connectivity that's
There is.
associated with this program, and I can only imagine as our population in Somerset County continues to get older, how important these programs are. Now, these are low costs, $1.25 fares. Obviously, that doesn't fund the whole program, so I'm sure there's a lot of federal and state funding, and each of the municipalities too designate a portion of their budget. So it's always important to recognize that while it might be low cost, it's someone's paying for it somewhere along
Exactly.
the line.
Yes, and it's affiliated with KB Cat.
Right.
And I do have that number that we can put up
Mhm.
at the end.
Great.
And our number, especially if you would like some accompaniment
Yeah.
on the first ride.
So we've talked about some of the programs that you are facilitating throughout the area. We talked about your work in the medical office buildings. But there's just so many things, and I'm sure you're uncovering more things as the days and weeks and months go on, as you're building this road, learning this position. Home visits, one-on-one problem solvings. We've talked a little bit about that, helping people fill out forms and so on and so forth. But I wanted to spend just a few minutes on this idea of the food insecurity. And that's a big part of what you're looking at, but that's another one of those words that I don't really understand. I'm insecure if it's 12:30 and I haven't had lunch yet, but that's not what you're talking
No.
about.
No. One of the questions that we ask on our forms when we initially meet with the client is, have you, in the last 12 months, at any point been without food because you couldn't afford it? And so that, if you say yes, that will lead me to believe that there are times within the year that it's hard for you to get food. And we will help with different resources in the area. We can help connect them with the DHHS, with SNAP-Ed, which is another form we will help fill out. Or we will encourage them to go to their local area food pantry. They can do so once a month, and if they need accompaniment, we'll be glad to accompany them as well.
Is this another form to fill out for that?
Yeah, more forms.
Yeah.
And it can be overwhelming, and that's why we're here. We're here to offer that service, to make it a little bit easier to get what you need to get.
And this is another one of your mantras that you'll continue to repeat. You assist people, you connect people, you accompany people, and I think that's one of the missing links that I'm so glad to hear from each of your interactions, is you always seem to mention, if you need help, we'll go with you. We'll get to the bus with you, we'll help you fill out forms, we'll accompany you to the food cupboard, because for a lot of folks, that's intimidating and that will keep them. When you talk to the members of the food cupboard, they'll say, boy, it's always the older generation that will wait till it's well beyond normal situation. They'll wait till there's no more cans of peas in the cupboard and everything's gone. They'll always wait. So what a great resource it is that you're able to actually say, not only can I point you in this direction, I'll walk with you there. And that's great.
And from
That's
that,
great.
the training that we took as community health workers, we went through deciding if it's not verbally stated, we can, look beyond what is being stated and what are the barriers for this person. Is it more than just lack of transportation? Is it intimidation, or is it any of those? And we look for those barriers and then help them overcome them.
And I'm assuming that each of you are available to speak at a small group session, a group of volunteers, come to an organization.
Sort of like
Yeah,
this.
exactly.
Absolutely.
Right.
And you've done a great job, and believe it or not, we've filled up just about an hour so far. But before we close this program of Now You Know, I'd like to just give each of you an opportunity, if you have any closing thoughts, if there's something we've covered that you want to make sure, or something we haven't covered that you want to make sure gets out there.
Well, I would speak to that volunteering
Yes.
piece, because I started volunteering in my community. When my son was born, I started volunteering in the local elementary school. Then I went to hospice. And I think there's a good fit for anyone who has some time, wants to give back, wants to pay it forward, however you want to say it. And one of the things we can also help with is the collection of different volunteer options that are out there. Because it is important that a person with that time, that motivation, find something that is a good fit, that touches your own passion, that you're moved from your own life into a place of service, whether it's a one-time event, maybe helping at school with a classroom, in a school library, a longer-term volunteer piece like through hospice, like through senior companion program.
Veteran to veteran.
There are so many possibilities to volunteer. And it's actually been shown that this improves our health. Don't we feel better?
We do. It gives you a purpose.
Yeah.
And it does, it diminishes any kind of isolation that you'd
Right.
be feeling stuck at home. You're out in the community, you're out in the neighborhood helping, and yeah, it gives you great purpose.
Yeah. And we're here in this community, in this county. I plan on staying here, aging well in place. I'm just wanting that service for me if I find the need, and I want to pay it forward.
I would like to go to the advanced directives. We're not going to have time to do
Yes.
all of them, but this is, most people are uncomfortable talking about what their end-of-life wishes are. And while it may be uncomfortable, the time to complete the forms is now, before it becomes necessary, and it will give guidance to your family. It's a living will, it's a legal document in which you have stated your wishes for your end-of-life care. It can be intimidating because the state of Maine online directives is 7 pages long. And the terminology is difficult to understand. I've taken some training, I will be taking more training in that area, and I can certainly, or we can certainly assist people with completing the forms and explaining what each section deals with. And I'll just briefly, you choose an agent, you decide whether you would like or not artificial nutrition at the end of your life. Do you want to be an organ donor? What are your wishes regarding your funeral or celebration of life? And do not resuscitate if you stop breathing or your heart stops beating. You know, what are your wishes in those under those circumstances?
I think that's a huge piece that, again, like we've talked of your, as the resource people coming alongside folks. I'll give you an example. My doctor's office gave Cheryl and I a living will or something like that, advance directive to go home and fill out. It is 7 pages long. I got through 5 pages of it and I shoved it aside because I lost interest, or it asked me for information that I didn't have readily available.
Or you didn't want to deal with.
Or I didn't know where to find
Yeah,
it.
right.
And so I thought, well, you know, we'll just push it off and do it later. But having worked myself in the field of hospice, working with loved ones who maybe knew something was coming but didn't take the necessary steps, the anguish that creates, that can be alleviated with some pre-planning. It's a huge step. So I really am so glad to hear that that's another resource that's available to folks in our community.
And we're not experts in any of these
Right.
things,
No.
but we certainly can help.
And you can find out where.
Yes.
Yeah.
If we don't know, we'll
connect
try to
people.
find out.
Yeah.
Excellent, excellent. Any final words from you?
No, I think we've covered everything.
We certainly have covered a lot, and I know that on the screen we'll make sure throughout the program we have the contact information for the mcdph.org website. If you need to contact the folks over at Somerset Public Health, that number 474-7473. and the special number for the Bone Builders Program, 8613534.
Or if they want additional information
I knew you
from the
guys weren't done.
programs that we, have talked about, call us.
Yeah.
Absolutely.
I did want to clarify, the number for the Living Well for Better Health workshop to be trained as a leader, it's actually to call Spectrum Generations, and the contact lady is Jennifer Fortin, and her number is 207-620-1657. So, not Somerset Public Health.
You realize by the end of this program, no one will be able to see you because the screen will be covered
I
with
know.
telephone numbers.
So many numbers,
And
yeah.
website addresses.
But you can always call one,
Yeah.
call
Call us
Somerset
and we
Public
can
Health,
always-
and we'll
Yeah.
address it.
We're the resource
Right,
girls.
yeah.
Exactly, well, great. Well, thank you for sharing on this program.
Thank you for
And-
having
And
us.
I hope that you folks continually stay busy, because the county certainly needs your expertise in all of this. So for Cheryl Curtis and for Liza Russell and for Christine Demchak, I'm Tim Curtis, saying thank you, and now you know.